Right, so my name is Michael Wright. I'm the Director of Public Affairs at Home Instead. Delighted to be here with you today. Many thanks to Engaging Dementia for organising the conference and inviting us to speak. I'm going to talk about home support in Ireland today and also tomorrow, because there's a reform agenda at government level for home support in Ireland, and I want to touch on what those ideas are and how they'll impact on people living with dementia in our communities. Okay, so I'm going to start by talking about what home support is and who provides HSE funded home support. I'll probably about 10 minutes, and then the remainder of the presentation will look at the home support reform agenda in Ireland. And if there are any questions, then we have time at the end or throughout. So what I want to talk about first is what home support is, so we all understand what I'm talking about. So home support is a service involving a paid professional who calls to someone's private home, and that person would provide a range of services, such as assistance with personal care, by which I mean helping with a shower or helping get to the toilet or helping with a catheter, or assistance with, say, something like meal preparation. Home support is also called home help, has been called home help in the past. It's also called home care. So these terms are often interchangeable. The HSE fund and deliver, and they also fund and commission home support. So they have their own HSE home support workers, and then they buy services from a range of different organisations throughout Ireland to provide home support also. HSE funded home support is free of charge to the service user. It's not means tested. The HSE fund home support through two arms within their social care division. And the social care division of the HSE is part of the HSE's community healthcare system. And this is organised into kind of 9 areas around Ireland. So the two arms that fund home support, they're split according to age. So people under the age of 65 will receive funding for home support from HSE Disability Services, and people over the age of 65 will receive funding for home support from HSE Older Persons Services. So depending on whether you are under or over 65, you may get different levels of funding, and you might also get different types of service. Generally, home support covers non-clinical, non-invasive supports and care to assist people remain independent at home. So it's not a nursing service, it's not a physio service. It wouldn't provide assistance with, say, wound dressings or help with, say, injections. It's very much a kind of a social care service. Now, what support you get, so in terms of answering that question, what is home support? So what support you get depends very much on how much time you have. In other words, how much time the HSE funds to support you. And because demand is greater than the HSE budget, HSE rations the amount of home support it funds per person. Because demand is greater than the HSE's budget, the HSE tends to prioritise personal care. So this is the assistance to the bathroom or getting dressed or assistance taking a shower. And the HSE will fund an amount of time to carry out these tasks. So let's say the HSE decides you need, or you're allowed, I suppose, 30 minutes to help get to the toilet. That might be the reason for the visit. If you look at how home support is allocated around the country, there are some differences. So, for example, if we look at the work Home Instead provides on behalf of the HSE, 3/4 of the visits in County Sligo are about 30 minutes in length. They're less than an hour. Whereas if we go to Dublin, nearly 100% of the work Home Instead provides on behalf of the HSE is an hour or more. So the length of the service that you get, length of the visit, can depend on where you live. So how does it work? So the HSE assesses individuals. So you may be in hospital, you may be in your own home. If you're in your own home, you'll get an assessment probably from a public health nurse. If you're in hospital, such as a community hospital, you might get an assessment from the discharge nurse. And based on this assessment, which is then sent to the HSE's local home support office, a decision will be made on how many hours of home support you're going to receive per week. Now, if we look at the data that Home Instead has, and we look at the average number of hours that the HSE's older person services funds that are delivered via Home Instead, then that average number is around 10 hours a week. So in Ireland, the average number of hours that somebody gets funded by HSE older person services provided by Home Instead is 10 hours per week. Now, we have at Home Instead a number of people under the age of 65. And what we find is that people under the age of 65 can receive slightly larger packages of support than those over the age of 65. What there is, though, for people over the age of 65 is a scheme called intensive home care packages. And people receiving intensive home care packages, they may get, say, 50 to 60 hours of support per week. If you look at the HSE's 2023 service plan, they wanted about 1,100 people to receive an intensive home care package. Now that compares with funding available for about 56,000 people to receive your normal home support package. So coming back to that question, what is home support? It kind of depends on how many hours of support you receive or you're funded by the HSE. If you have an intensive home care package, you're going to have a lot more time for activities that are mentally stimulating and socially engaging. If your package is merely an hour a day, the supports you are likely to receive are going to focus on your personal care and maybe medication prompting. It's important also to note that home support has a scope of practice. So it'll cover, say, medication prompting. So a home support worker may remind you to take a medication, but it tends not to cover medication administration. So if you need assistance with eye drops because maybe you live by yourself and you're not in a position to administer the eye drops to yourself, your home support worker may not be able to carry out that task. Now, some providers may, depending on their own scope of service, but the HSE's own home support service are not able to deliver things like eye drops. So some things aren't allowed within home support. General housekeeping, for example, is not allowed in a home support service that's funded by the HSE. It's also important to say that the HSE generally direct the type of support that you will receive. So if you get 10 hours a week, generally the HSE will say this is the specific purpose that care is to be allocated for. So you might have an hour a day, and that's to cover a shower, it's to cover assistance getting dressed, it's to cover medication prompts, and that's it. And let's say you have a family member or a spouse, for example, who wants to shower you. So maybe you can bank those hours, use those hours maybe for assistance with exercise or meal preparation. That may not be possible. Now, there is a scheme. It's not widely implemented, but there is a scheme called consumer-directed home support. And this is where the number of hours the HSE are funding on your behalf, you can choose with the provider of your service when and what type of service you receive. So there is a mechanism within the HSE's home support service where you could say, do you know what, my spouse provides me with the shower, so please can we use these hours for something different? However, it's not available in all areas of the country. So if you're living with dementia and if you're in receipt of a home support service, the basic service is very task orientated, and it may not meet your needs for, say, respite or socialization or to help improve your nutrition. There may not be time for just things like fun or going out. But if you do receive, say, an intensive home care package, or you just get a larger package, whatever it's labeled, then there could well be time for above. Your home support worker could spend time in the garden with you, you could go for a good walk, you could get fresh air, you could get exercise and meet people. So all these things are possible within home support. I guess the caveat is there time to do this, and what is the HSE who's funding this going to prioritize? The bigger the package of support, the more flexibility you have in terms of when you might want to take a shower, or whether you're going to have breakfast in bed or breakfast in the garden. So if your home support worker is visiting you for a 3-hour visit, you've obviously got time within those 3 hours to prioritize what you want done when. Whereas if you've only got 30 minutes and the key piece of work that the home support worker is helping you with is to have a shower, then when the home support worker arrives, well, that's when the shower is going to get done. And the time that the home support worker arrives is going to depend on the roster of the home care support worker. So if they're visiting someone at 8 o'clock in the morning and then someone else at 8:45 and they're calling to you at 9:30, that's when you're going to have your shower. You can't say, can I have a shower at 11 o'clock on a Sunday, because at 11 o'clock on a Sunday, other people may be visited by that home support worker. The bottom there, I just wanted to bring that up, and this kind of almost dovetails into the previous conversation around nursing home. So we have, I suppose, and this is changing, right? But there can sometimes be a little bit of paternalism within the Irish healthcare system, whereby you suddenly find yourself in hospital, and that could have been because you've had a fall, or maybe you've had some cardiac issues, and all of a sudden the professionals are nervous about sending you home because you're alone at home, and someone comes up with the idea that maybe a nursing home is more appropriate because a nursing home provides, say, 24-hour care. Now, a nursing home may have support around the clock, but I think it's important to note that nursing homes don't provide 24-hour care. This data here is taken from a Nursing Homes Ireland report commissioned by BDO, and it was looking at the number of hours that a nursing home resident in Ireland on average gets in terms of one-to-one support from a nurse or a healthcare assistant, either in their own room or in a congregated care setting. So you can see in a nursing home, you get 24-hour support, but in terms of the actual hourly interactions you get, it's around 3.6 hours a day. And coming back to the stat I gave you earlier, which is that the average home support package funded by the HSE's older person services that Home Instead delivers, well, that's 10 hours a week, which is about 1.4 hours a day. So when we think about home support and we think about risk and we think about autonomy and we think about choices, it's really important just to bear in mind the differences in one-to-one support that you would get in a nursing home versus your HSE home support service. Okay, so that's a kind of general overview of what home support is. In terms of providers of HSE home support, in 2021, 37% of HSE home support hours were provided by HSE employed staff, and the remainder was provided by over 100 different organizations. Some of those organizations are kind of large, not-for-profit organizations like family carers, others are small charities, others are large private companies like Home Instead, others are small private companies, run by one or two people. And the HSE contracts about 100 different providers around Ireland to do that. What's also important to add is, look at, and this was in a HICWA report of home support that was published last year, like 90% of the home support hours, if we want to call it that, provided in Ireland are provided by unpaid family and friends. So the bulk of home support is family and friends. There is also a private pay market, and what I mean by that is that there are people available that you can purchase home care from, either companies or individuals on, say, websites advertising home support. So there is a private pay market in Ireland. Now, one of the challenges we do have in Ireland is an issue with capacity. So at the end of March this year, the government had hoped that the HSE would provide about 5.8 million hours of home support. The actual activity was 5.2 million hours. And that's led to a waiting list of around 7,000 people waiting for home support funded by the HSE. And the waiting list is not there due to lack of money. It's due to a lack of available home support workers who can provide the hours that the HSE wants to fund. So I think it's important to note that there is a statutory right to nursing home care. If you can find a bed, it's going to be funded. So that means if you're in, say, a hospital environment and you're waiting for discharge, you kind of know that it's available, what the type of service you're going to get is. However, for home care, until you actually have that assessment, until your home care is approved in the local HSE office, it's difficult to know whether you're going to get 5 hours or 15 hours or 50 hours of care. So there's no universal assessment process at this moment in time. The HSE roll out what they call the single assessment tool, which will standardize the assessment process and make it a lot fairer why people get the service that they do. There are, at the moment, regional variations because there is no universal assessment tool in terms of the hours of home support. You might already mentioned that in Sligo, 3/4 of our services are less than 60 minutes in length, and whereas in Dublin, it's all around an hour. I think it's also important to note that there's no real choice of provider at this moment in time. Part of that is a capacity issue, but equally the HSE have a role where if their staff can provide you with home support, then they will. So that could mean that you get the HSE service Monday to Friday, whereas at the weekends where the HSE don't have any service, then it's a different organization. What can also happen is if you're having, say, a service with a different provider, and then capacity becomes available within the HSE, your service may be switched from that provider back to the HSE. So the HSE has the right of first refusal, I suppose, for all work, and, mean that things can happen necessarily without your consent. I think the last thing to say then about HSE home support is it's unregulated. So there's no systematic auditing of HSE home support or indeed private home support. HICWA aren't involved at this moment in time. So this slide is just around private home care, and I just wanted to say a couple of things. First thing is pay as you go. So if it's affordable for you, then this may be an option for you. If it's not affordable for you, it's not an option. There is tax relief available. So if you or a family member by marriage are paying income tax, this person, if they are the bill payer, can then claim tax relief. So in the same way that people get money back in their income tax bills for, say, visiting a physiotherapist or a GP, you can also get tax relief on home care, up to 40%. So if you're lucky enough to have cash, or a family member does, then tax relief is available. I also want to note that there is one insurance company, Irish Life Health, and they fund a small amount of home care hours through one of their pathways. Okay, so I now want to talk about the future. So we have the issue with waiting. The first thing that needs to happen then is that we need to encourage more people to become home support workers in Ireland. So the Department of Health published a workforce report at the end of last year. The Minister for Older Persons, Mary Butler, who opened the conference, has allowed people outside the EEA to come to Ireland. However, the HSE Older Persons budget also needs to increase, and it needs to increase to ensure that workforce is properly compensated, so that providers get paid, say, the same amount of wherever they deliver a service in Ireland. We have an issue at the moment whereby they're cherry picking, in that if you're living in an urban area, you might be more likely to get a service than in a rural area. And the reason for that is that the HSE funds care in, say, Limerick or Galway in the same way that it does live on the Dingle Peninsula or in Belmullet. So the additional mileage fees that a carer would need to go to a more rural location compensated within the current contract, and that can lead to capacity issues. We also, to increase home support worker capacity, need to look at career pathways. So how do we reward and recognize someone who's been many years as a home support worker? Is there a pathway into nursing? And we need to integrate home support into the local multidisciplinary team. Often your home support worker is visiting every day, so they're the most likely person to spot things are changing. And if they can feed that back to a public health nurse or a physio, that may result in an intervention leading to better outcomes. And I think it's also important that we should look in increasing capacity at how do we get home support workers to work top of scope. So can we get home support workers to assist with, say, eye drops, for example, which they may not be allowed to at this moment. So the other thing that's going to happen is we need to regulate home support. At the moment, the Department of Health is finalizing a consultation process, and we expect in the next couple of months the DOH will publish its final draft of home support regulations, which will then go to the Oireachtas. Dovetailing that piece of work from the Department of Health, HICWA are putting in place standards which will drive up quality in home support. Now, we haven't seen this final version of the regs from the DOH, and I guess we have to ask ourselves, well, how are care workers going to be vetted? Are all care workers, will it be mandatory for care workers to be Garda vetted prior to them starting work in somebody's house? What about training? How are we going to ensure that somebody who's providing home support has the necessary skills and understanding of dementia, the ability to deal with or help somebody with showing a responsive behavior? How are we going to ensure that carers are supported and mentored? How are we going to assess their competence? We don't know as yet whether the regulations are going to insist on certain training and supervision of home support workers around their knowledge and skills supporting people with dementia. So I think this is all going to come out in the wash over the next couple of weeks, which makes it an exciting time, I suppose, for home support. And we are seeing progress, which is great. The final piece of work within the home support reform agenda is, will we have a statutory right to home support? So earlier, we have a statutory right for nursing home care. We don't have a statutory right for home care. And there's some big decisions that need to be made for that to be put in place. The first thing, I suppose, is who pays. I mean, at the moment, home support is free of charge to the service user. Obviously, under the Fair Deal scheme, people pay either out of their general income, or they get a loan off the HSE. They then pay back when they pass. We don't know how home support is going to be funded. We're also not quite sure what the model of care is going to be. So I've talked about how an average HSE's home support package funded by older person services around 10 hours a week. That covers many, many tasks. Is that the model of care which you're going to have a statutory right to? In other words, will you have a statutory right to a shower, or will you have statutory right to social experiences, to better nutrition, to getting out and about? What type of model are we going to fund? How's choice going to work? Will I be able to choose between the HSE and Home Instead and Family Carers Ireland or the Irish Wheelchair Association? What if I want to change my mind over provider? How does that work? And how do I control when the service is delivered and what is delivered within that service? And how transparent is this whole process going to be? How do I know that if I am making a co-payment, that I'm getting value for money? So these are some big political questions. At the moment, home support is free, and whether there's any politician brave enough to impose an additional payment by people for this service. Maybe if the service expands beyond what is currently being offered, then people will, or maybe we'll have to find additional funding to fund more hours and ensure that people have a service that they wish for. Okay, so this is my final word. Lobby your politicians. Like I say, we have a need for more funding at this moment in time. These regulations in place, they need to be the right regulations, and they've got to ensure carers are vetted, that staff are well trained, and that level of care is properly supervised. And then lastly, whether we'll get statutory home care, it's on the current program for government, but we're practically within the last 12 months of this government. So whether we'll see it or not, I don't know. We need to make sure that if there is another election, that statutory home care is something that they're about on the doorstep, and that they face up to the big decisions they need about it and put it in place.
So we're just going to take one question here. So this one is, it's very difficult for people with dementia to have 4 or 5 different carers calling into them in the course of a week. Is there any way to ensure that only 2 are allocated to allow for sick leave and holiday leave?
Yeah, I think that's a really good question. And it comes down to the lack of capacity in the system. So what we have then is we have people who are working part-time. And because they're working part-time, they may only be able to work 2 or 3 days a week. So a lot of home support workers may have family commitments, they may have study commitments and so forth. What we need is to move to a more sustainable model of, I suppose, home care funding, which will allow maybe more permanent contracts to be offered. And if we can give more permanent contracts, then hopefully we can say, right, we're going to have 1 or 2 people work because they can commit to do that. I think the other issue we have is with social welfare. So some social welfare payments will limit the number of days you can work, or they'll limit the number of hours that you can work. And if we look at peak demand for home support, peak demand is between 9 o'clock in the morning and 11 o'clock in the morning, because that's when everybody wants to get up and have a shower and get ready for the day. So it's not really, we don't need a 9 till 5 workforce 100%, because what do people do at 3 o'clock in the afternoon? No one wants a shower in the afternoon. So part of the issue is because we have peak demand early in the morning. We need a part-time workforce to provide that. And because we need a part-time workforce, you have all the difficulties around social welfare. You have the difficulties around other commitments that an individual might have. So again, I think the solutions are, how do we get more funding into the system? How do we get social welfare reform? And hopefully Minister Humphreys will look at some reform ideas that have been put forward within the DOH's workforce report on how to help people on social welfare work, say, 6 days a week when they're, and when I say 6 days a week, I mean maybe 3 or 4 hours in the morning. So do 18 hours over 6 days rather than 18 hours over 3 days, which their social welfare may limit them to. So I think that's an issue. I think you have that conflict then between what service users want, which is continuity of care, and the restrictions on carer capacity that we have at the moment. So I don't think there's a silver bullet, but absolutely it's work that needs to be carried out. That needs to improve.